Is it clear? So generally, in order for you to visualize a hemorrhagic stroke, the simple test that you need to ask for the prothrombin time and the partial thromboplastin time. This is going to help you visualize for the bleeding time. If there's a problem with coagulation, is it clear? If there's a coagulopathy disorder, is it clear? Or if the patient is taking prolonged anticoagulant, is it clear? You ask for prothrombin time and partial thromboplastin time with the INR, international normalization ratio. Is it clear? To visualize if the patient have a bleeding time which is elevated, to visualize the functionality of the secondary hemostasis. The second thing is that you ask for a full blood count. A full blood count is going to tell you for primary hemostasis, because a platelet can tell you if the platelets are sufficient in amount for primary hemostasis. Is it clear? Still a problem of clotting. The third element, in order now, these are the laboratory investigation that you ask in order for hemorrhagic stroke. Now, the imaging investigation that asks for the cause of hemorrhagic stroke, you now ask for a CT, a brain CT angiography. Is it clear? A brain CT angiography. The brain CT angiography is going to tell you malformation of blood vessels like arteriovenous malformation. It can tell you aneurysms. It can tell you cavernomas. Is it called meningiomas? Is it clear? You can see it with a CT scan angiography, CT angiography of the brain. Is it clear? So those are the different elements that you have to assess on your investigation. Now, the next element that you have to assess on your investigation after this. So after assessing all this on your investigation, you need to assess for the next element in stroke. Is it clear? On your investigation, you need to assess now the complication. Is it clear? Now, when you are investigating for the complication, is it clear? Still, for cerebral edema, you still ask for a CT scan where you are going to see what for cerebral edema. You're going to see effacement, or you're going to see absence of the sulci. Is it clear? Or you have a gray and white matter non-dissociation. Is it clear? When you have a gray white matter non-dissociation, or you have absence of sulci, is it clear? It may tell you that the patient has cerebral edema. So those are the signs of cerebral edema on the CT scan. Is it clear? But it's going to be best seen with a brain MRI. Is it clear? Now the next one is hydrocephalus. Hydrocephalus can be seen also on the CT scan by what? It can be seen with dilation of the ventricle. When you have dilation of the ventricle on the CT scan, it can tell you that it's hydrocephalus. Is it clear? So those are the different elements that you can visualize in order to know the complication, actual complication of stroke. If a patient has post-stroke seizure associated with an epilepsy after stroke, is it clear? It means that you are going to ask for an EEG. Is it clear? If the patient has post-stroke seizure, ask for EEG. If the patient has cerebral edema, see the CT scan. That same CT scan can tell you, or brain MRI. Is it clear? So those are the different elements. Now, for the other complication, which are the prolonged decubitus complication, the pulmonary embolism. Pulmonary embolism, you first ask for D-dimer to support as laboratory investigation, and then to visualize for deep venous thrombosis, you ask for a Doppler ultrasound of the leg. You ask for a Doppler ultrasound of the leg to visualize for deep venous thrombosis, and then you also do a chest. You also do a chest angiography. Is it clear? So a chest angiography is going to help you, for a pulmonary angiography is going to help you to know if there is a pulmonary embolism. Is it clear? So those are the different elements that you have to assess for. So for pulmonary stasis, you just need to ask for a chest X-ray. So for a when you have a constipation, so constipation is clinical, but if you think of other elements of intestinal obstruction, you may also ask for other elements like an abdominal or a plain abdominal X-ray to visualize for dilated bowel loops. Is it clear? So those are the different elements that you have to assess now for the complication. Is it clear? So after assessing all this, we now need to go now to the management of a patient that has stroke. Thank you.